Dermatological conditions, fungal and viral conditions. Fungal skin conditions. Fungus grows and thrives in dark, warm, and moist environments, such as the areas between the toes or between the skin of the groin and the scrotum. Signs and symptoms of fungal skin conditions include small patches of erythema or redness, scaling, and severe itching. Some common causes are from dermaphytes, also known as ringworm, and yeast. Fungal skin conditions are often contagious and spread person to person by sharing of towels or socks, walking with no shoes in a locker room or shower. During activity, perspiration often accumulates in these dark, moist areas. Augmented with wearing constrictive clothing such as an athletic supporter, tight shorts, or spandex, the perspiration often enhances and encourages fungal growth. In addition, tight garments often cause chafing and irritation, which breaks the skin and allows the fungal infection to occur. Different types of fungal skin conditions occur in different parts of the body. Tinea unguenum is a fungal infection of the toenails. This is characterized by a yellowing of the nail, a separation of the nail plate from the bed, and accumulation of subunguenal debris. The treatment will vary depending upon the type of infection, and the severity of the nail changes, and the personal preference of the supervising physician and the patient. Tinea pedis is also known as athlete's foot. This is the most frequent fungal infection in the physically active population. Some individuals may not be affected by tinea pedis. Common signs and symptoms include redness and scaling on the soles of the feet and between the toes. When the toe webs are macerated or infected, a Candida yeast is usually present in addition to the original dermaphyte. Scratching the area will lead to scaling, peeling, and cracking fissures in the skin, particularly between the toes, and can spread the problem to other body parts. Tinea curis is known as jock itch and occurs in the groin. This involves the genitalia, but often originates in the feet. Usually this occurs when someone scratches their athlete's foot and then touches other body parts. Curl or peritoneal folds between the scrotum and the inner thighs are usually the first areas to exhibit small patches of erythema and scaling. Other signs and symptoms include diffuse, thick, dark lesions, weeping vesicles or pustules on the margins of the inflammation, and severe itching. The infection can spread to the thighs, perineal area, buttocks, and abdomen. Tinea corpus gladiatorum is tinea of the body. This is characterized by circular, puritic patches that are well demarcated and scaly with raised borders and a central healing zone. Their well-defined central ring is generally found on the upper extremities, axilla, and the trunk. Tinea capitis is ringworm of the scalp. The primary source of the infection are contaminated hairbrushes, combs, or even animals. This typically begins as small papules on the scalp and spreads peripherally. The lesions appear as small gray scales, resulting in scattered bald patches on the head. Tinea versicolor and candidiasis are yeast infections. Tinea versicolor is a yeast infection common to active individuals. It is a normal inhabitant of hair follicles and sebaceous glands that grow rapidly on warm, moist skin. This is most often seen on the trunk, upper arms, neck, abdomen, groin, and thighs, and it may even resemble freckles. This is commonly referred to as sunspots. Tinea versicolor is best noticed after exposure to the sun. While the rest of the skin tans, the area with the tinea versicolor will not. Candidiasis is caused by the yeast fungus Candida albicans. This is an infection on the skin or mucous membranes or even in the vagina. This is more common in women who wear swimsuits or competition uniforms for long periods of time. Lesions appear as a deep, beefy red color and is bordered by small red satellite pustules. Fungal skin conditions can commonly be managed by antifungal medication, changing warm, moist environments such as changing clothes out, and if it is widespread or the condition does not clear, a physician referral is warranted. Viral skin conditions. The herpes simplex virus. We have herpes simplex 1 and herpes simplex 2. Herpes simplex 1 is most commonly referred to as cold sores. This infects the area of the lips, nose, and chin. Herpes simplex 1 causes about one-third of all new cases of genital herpes. It is transmitted most often through oral sex and is extremely contagious. Herpes simplex virus 2 usually causes sores in the genitals, the vagina, the penis, and the anus, and the skin around those areas. This causes two-thirds of all new genital herpes cases and 95% of recurrence of genital herpes. This is the most common sexually transmitted disease in the United States. Herpes gladiatorium. This is caused by the herpes simplex virus type 1. The transmission occurs with direct skin-to-skin contact. Infection may cause no other symptoms or may involve fever, localized swelling, malaise, myalgia or muscle pain, pharyngitis, or rarely keratoconjunctivitis, which is an infection of the eye. Pre-existing abrasions or other underlying skin conditions will increase the likelihood of transmission. During the ulceration and crusting stage, the rash is often confused with impetigo, which may delay proper treatment. Signs and symptoms include burning, stinging pain, tenderness or itching at the site, followed by clusters of vesicles on the skin. The lesions typically reoccur. It is critical to identify this condition early. The management for this condition is immediate physician referral. The most common sites include the head, upper extremities, and the trunk. The incubation period can be from 2 to 12 days. Herpes zoster, also known as shingles, local trauma in contact sports, occasionally can precipitate reactivation of the varicella virus. Signs and symptoms include unilateral blister-like lesions that erupt along a dermatome, usually T3 to L3. Other signs and symptoms include headache, malaise, swollen lymph nodes near the site of the eruption, and a low-grade fever. Participants in contact sports should be prohibited, both for the pain relief and to lessen the transmission to others who have never had chickenpox. Oral antiviral drugs may be prescribed and must be taken early or they are not effective. If the condition is not recognized and treated early, then the physician will likely advise the individual to let shingles run its course. A case of shingles, although painful, usually heals entirely within a month, with or without treatment. Because human immunodeficiency virus, or HIV, can participate herpes zoster in a young individual, an HIV test is often ordered. Verrucai virus. Verrucai virus is more than 60 types of the human papillomavirus, or HPV, that can lead to the rapid growth of cells on the outer layer of the skin, resulting in a wart. Verrucai just means wart. Pressure on the wart will typically increase the pain in the individual. This is often subjected to secondary bacterial infection because of its location. Plantar warts are a specific type of the Verrucai virus, typically a red or black dot representing capillaries that have been penetrated by the root of the wart are present, and they look like little seeds, or even like there is a splinter inside of the wart. They're likely transmitted from swimming pool decks or shower rooms. Within 6 months, most young people will develop an immunological reaction to the virus, and the wart may disappear with or without treatment. For others, any treatment will be ineffective and the warts will reappear. These warts may require significant intervention and removal by a physician. Musculosum contagiosum is a pox virus. This is spread by personal contact in contaminated swimming pools and gymnastic equipment. The signs and symptoms typically include lesions that have a pearly papule, 3 to 5 centimeters. They are flesh-colored to yellow and have a tiny round spot in the surface. They are primarily a cosmetic problem, but blunt trauma can rupture a papule, causing a disabling local inflammatory reaction. The management is immediate referral to a physician. A physician may use a destructive mechanical modality, such as a curettage, electrical therapy, or cryotherapy with liquid nitrogen to treat these areas. Chemical treatments may also occur. Full activity can be resumed in 2 to 4 days after the resolution of symptoms. This condition is highly contagious,